if the doctor, as a result of undergoing all these tests in your body, may find out that there are some irregularities, the doctor may ask you to go for imaging tests. One of those imaging tests is what we take as magnetic resonance imaging. This magnetic resonance imaging is when the doctor may undergo an imaging test on your body to know all the things about your inside part of the body, to know whether things are in order or not, whether you have irregularities in your sexual organs or not. Another test the doctor may ask you to go for is a test that we know as Hysterosalpingography. This Hysterosalpingography is when a special dye is inserted into your uterus through the cervix. Now, an X-ray is taken following the dye when it moves through your organs in order to know the size and shape of your organs. Another test is the ultrasound. Normal ultrasound we know. Ultrasound o nwere ike asị nwaanyị nwa mmiri enough, ọnwa mmiri ete ya gel n'afọ, so that when the wave is moving, the doctor may now dictate if there is an irregularity in the uterus of the woman. Sonohysterogram is another image test that the doctor may ask you to go for. This sonohysterogram is when a special dye is inserted into your uterus through your cervix. Now, ọ bụ na etinyezie this special dye n'ime your uterus through your cervix, efozia na aye use kwazi an ultrasound to get the image of your uterus, ka amalụ both the size and shape of your uterus. If there is any irregularity in your uterus, the doctor may find out through this sonohysterogram. If ndị kwesịrị ịma concerning this uterine diabetes bụ na nwaanyị ọbụla na-suffer from this uterine diabetes na-adị ata afọ, because you know that this uterine diabetes, a woman will have 2 wombs and then 2 vaginas. So sometimes some of them, when they are having their menstrual cycle, the menstrual cycle will take place only in one part of the vagina, and then one part of the uterus. Then ofosia nke afọ ọ na-esi na that one apụta, another menstrual cycle ebidokwe na another side. Ifu na onye enwa nọ n'afọ oge niile ọ nọ na menstruation, oge niile ọ nọ na menstruation. So the only thing they have to do is then to correct all this problem by what? Trying to find a way to cut the dot kewalo those 2 cervices and then those 2 uterus and make them to be one. Some of the women again that do experience this uterine diabetes, sometimes they do not have much problem. They give birth to children, they get pregnancy, yes, they do not have any problem. The only thing is that they have the problem of maybe having painful menstruation before or during the time of their menstruation. Then sex, when they are having sex, they may be having some pains. Sometimes again have several miscarriages, just as we have said earlier. But some of them do not have this problem, but they know they have this problem known as uterine diabetes.